So we are really working to de-escalate treatment and not overtreat patients. And one of the most debilitating side effects from breast cancer treatment is lymphedema, as where patients who, after they go through their surgery and radiation and chemotherapy, have a swollen arm. That can be managed, but it's a lifelong problem. And it's really something that distresses patients greatly. Some patients feel like it's worse than the cancer they had. So I think that's where the efforts of identifying the lymphedema risk in young women, that was reported in the study from Dana-Farber, was very, very important. This was a young woman's cohort, which basically demonstrated that a substantial number of patients have arm symptoms, particularly if they have lymph node dissections. Minimizing the number of patients who need to have lymph node dissections, and even minimizing the number of patients who have sentinel node biopsies. In other words, doing less surgery in the axilla, unless it really benefits patients, is extremely important. And then novel techniques, as I talked about, doing lymphatic venous bypass at the time of lymph node dissection for the patients who need to have their lymph nodes removed because they have more advanced disease. By applying this advanced surgical technique, greatly reduces the chance of patients developing lymphedema. So I think it is a very, very important area for people to be aware about. The other one, I think, is the whole area of ductal carcinoma in situ, and wanting to really work hard not to overtreat patients. So the natural history of ductal carcinoma in situ is not that well understood. Some patients progress to invasive cancer, but some don't. So we really are concerned about overtreatment, and that overtreatment can mean unnecessary surgery, unnecessary radiation. So really beginning to select the patients who need to be treated and looking at alternative treatments, which are non-surgical and non-radiation, using medication, aromatase inhibitors, and that was pointed out in the study by Dr. Wong, Shelley Wong. There was a pilot looking at letrozole, which is an aromatase inhibitor, which showed in a substantial number of patients very great benefit. So as a primary therapy, and big trials are now looking at that, what's called active surveillance with medical therapy versus usual care with surgery and radiation, and I think we'll get a lot of important information from that, but I think that's an important area to focus on.